I've had depression for at least 20, 25 years. It wasn't too bad at the beginning and stuff, and then it progressively got worse. I've tried pretty much every antidepressant, anti-anxiety, everything out there, and none of it would work. Maybe the last 2 to 3 years that it got really bad, where I wasn't able to function, I wasn't being able to get out of bed. I could just basically go to work and then come home, and that's all I could do. After that, my therapist we finally got to the point where it was, let's try ECT, let's try something else, and see if that will do something, since obviously no medication's working or anything.
ECT tends to be the most effective option. So the response rates with ECT are much higher than with most other options. They lie between 70 and 90% depending on the kind of depression that a patient struggles with. There's this perception in the general public that this is a scary procedure, whereas in reality, it's a safe procedure. It consists of a generalized seizure that is being induced under very controlled conditions. It is a very brief procedure. It is highly effective. The most common side effects with ECT are headache and nausea, but we always pre-medicate our patients to prevent that. The main concern with ECT in terms of side effect are the cognitive issues.
Oh, I was absolutely willing to try just about anything. Have a little bit of memory loss or lose my life. That's kind of where it was to the point. It was just the benefits outweighed the side effects.
Miranda responded really well to the ECT, and in a rather typical way. It took a few treatments for her to start feeling better, and then she noticed ongoing and incremental benefit with further treatments.
It just felt like there was a weight off my shoulder, and it's I went from thinking about suicide 20 to 30 times a day to maybe just fleeting thoughts once or twice every couple weeks. It's exciting to actually participate in life and be able to, even just simple things like cooking dinner together, or, with my wife that I look forward to now. Even just adopting a dog, that's not something I would have probably done a year or two ago. We're planning things for future, vacations, and saying when we buy a house or this, or just making future plans and stuff that I never really even thought of before. And I would absolutely recommend it to somebody. I know it can be a scary thing for people who have tried everything like I have, and I know there's a lot of people out there that have tried multiple different things and haven't been able to get the relief that they're looking for.
It's a big deal. Having somebody feel well after they have not felt well, sometimes for 10 years or longer. We hear it quite often, actually, that patients say, I haven't felt this good in years, or you have saved my life. And that's always very moving and makes our day every time.
It's life-changing. That's basically just it. It's absolutely life-changing. And I know that probably everybody won't have, everybody has different results and everything, but for me it was absolutely life-changing.